All right, welcome. I think we're getting really close. Again, thank you all for coming. You'll note on the slide as we approach commencing the deck that we are entering a different phase of our public build. It's the final collaborative phase before the vote, the end-to-end review. We'll talk more about that as we go forward, but it's the time to carefully review and revise the terms that we have created together so far. I believe we're ready to kick off. All right, next slide. And again, thank you for your patience. We were literally just on a prior calls, back-to-back calls today for Gravity. Thank you for joining the Gravity Project community meeting again. For those who might have missed it, my name is Sarah DeSilvi, and I am the Director of Terminology for Gravity. We do ask that folks mute upon entry, but we have a very collaborative and consensus-based space. So if you have anything you want to say, put it in the chat to everybody so everybody can see it, or raise your hand throughout the presentation. We try to make sure that we're integrating comments and questions as we go forward. And then next slide. This is the antitrust practices slide. It's an HL7 requirement. We are an HL7 accelerator project. And just basically the summary statement is that anyone who participates in Gravity has the responsibility to comply fully with federal and state antitrust laws. Next slide. So we do, I believe one of our subject matter experts is on the call today, or will be shortly, Diana. And then let me just see, I think she should be joining. I know she has child pickup at this time. And I hope Debbie can join us as well. What we're going to be presenting is a couple domain revisions. Just, we are consensus based. So if there's new terms that are in the ecosystem or missing terms that implementers have noticed, we try to integrate them into our public phases for your awareness. And then because we're entering end-to-end review, what you're seeing is over the course of the next couple meetings will just be noted absences that we're putting on, that we're suggesting for you, things that we assessed as possibly being extraneous that we're pulling back, and we'll go forward more about this later, or just tweaks and edits, right? Collectively, this is like the final phase of a final project, right? A collaborative project where we're just sitting back and making sure it's complete and correct. And then we'll close with community homeworks and next steps. Next slide. Next slide. There are a couple more days for any public comments on the ISO10CM for digital literacy. Actually, a couple more weeks, I should say. May 17th is the deadline for that. All of the information on submitting you can find on the Confluence. And then we have our technical workstream calls Wednesdays from 1 to 2. And then next week is our implementation affinity group. I believe, I don't want to put anyone on the spot here, but I believe our friends on the technical team, Monique is here. It's going to be Monique, and I'm sorry to call you out. I know I should have told you. Do you want to briefly talk about what's happening on the affinity group next week? Sorry to put.
Yes, sure. On the affinity group next week, we're going to discuss a bit about in particular, the observation screening response that's in the implementation guide, and some of the things that you can do with it. For example, exactly how to use observation category and what it means, and also observation interpretation to flag findings. For example, if you answer that you're worrying about food, to flag that finding as positive and what that actually means. It doesn't mean that you have food insecurity. It means there's a potential for an HRSN risk associated with that observation. So we're going to discuss that. We're also going to discuss how to take a bunch of observations that are generated from a assessment instrument and group them into something called an observation grouping. That's the two primary focuses, and then we'll touch a little bit on structure map and how you might use it to auto-generate some observations from an assessment instrument.
And then this is how everyone can understand how brilliant our friend Monique is. So specifically, this is an outgrowth of our work with the state of New York. And so we're always welcome to take learnings that we have with implementers and bring them in. And we're trying to alternate in the affinity group terminology conversations and technical conversations every other month. And we'll be back with terminology conversations in May, focusing, well, that's actually terminology and tech, focusing on concepts and reporting and documenting outcomes. All right, and then last meeting that we had was terminology. We'll talk briefly about that because it relates to some new terms we're going to make sure are in our value sets for this cycle. Next slide. These are our core use cases, documenting social care data at patient-client encounters, tracking social care interventions to completion, and gathering and aggregating social care data for uses beyond the point of care. Next slide. Next slide. This is our roadmap. We've presented it before. Again, just want to make sure that everyone's aware, looking down to the fall, we have our fall domains that we're preparing for, the Coding for Food HICPIC initiative with our Food is Medicine friends, language barriers really driven by our growing understanding of language with our work on digital literacy and health literacy and language considerations. And really a CMS, ONC, all HHS focus on language preferences and language needs as part of a health equity initiative. So we're leaning into that. And then we have been talking a little bit about history of legal involvement and history of incarceration. So we'll be dealing with that as well. I want to note that both of the language barriers and history of legal involvement and incarceration did come from implementers elevating them. So people are out in the world using our terminology, and they noted that they wanted Gravity's assistance to ensure the standards for these two things had our full consideration. So that's why they're there. And then there is a potential new use case hitting the ground with as our outgrowth with exploring both social care payment and reporting and outcomes and tracking and measurement. Really out of the use case on intervention outcomes tracking and measurement is why we're presenting on all the things we can do next affinity group, not next as in next week, but in May. Because we already have a lot we can do. So we want to make sure our members, implementers understand what we've built with outcomes tracking in mind before we do anything new. We are working on updates to the implementation guide to ready that for the spring. And then we're always improving our education and dissemination elements. Busy world over here. I'm glad you all are here. Next slide. And really lucky that so many of you are in all the meetings and all the places. It's good to see people across all the spaces. So thank you. Any questions on the roadmap? All right, next slide. And next slide. Okay, next slide. This is the meat of what we do in terminology. We're entering end-to-end review. And we're going to talk about what that means. Again, it's the final collaborative phase of what we do before we head into vote. Next slide. And so we have two meetings where we do end-to-end review. This meeting here on the 18th, and then the 2nd, and then we go into vote on the 16th. Sometimes we bump the vote a little bit if we need to, but we're pretty much right on track. As part of end-to-end review, it's really critical that you download the master and help us make sure that they're correct and right and represent our work. We'll talk more about that in a couple of minutes. Next slide. This is the principle of what we do in end-to-end review. It's a shift, right? So we just left the identify phase, which is, what is this thing? Like, what is utility insecurity? What is energy insecurity? What elements of water insecurity do we want to focus within our utility insecurity work? Right, so there's lots of identification, gap filling, lay of the land work. When we enter end-to-end review, it's kind of a more formal process than we've had before, because number one, we really want to make sure that we document anything that is changed formally from a change control process. And so what we're asking of all of us, right, and you can send it around to friends in the ecosystem, right, is it's a time to step back and consider the whole master list and ask questions. Are there missing concepts? And you can see that the Gravity team itself is doing that. Now that we have enough of the gaps filled, we're able to see patterns and omissions. And so we'll look back at the whole list and we say, are we missing things? And we say, yeah, we are. And then we build concepts to fill those gaps. Are there incorrect concepts that need to be changed? This is everything from changing the capital where there shouldn't be a capital to like not a correct definition or needing to refine the formal naming of something. So changing things that are incorrect is that second element. So we have, is something missing and is something incorrect? And then the last thing is from a frugality perspective, right? We try, to make sure that we're following precedent for previous build and that we're building frugally to not overwhelm the ecosystem, and we're really building what's necessary. So we also step back and say, are there concepts that are unnecessary and they should be removed, right? And it doesn't mean they can't come back. It just means that we don't need them. We don't know if we need them right now, and we can collectively have conversation if we feel like a removal was unnecessary. But we think about that unnecessary from a precedent perspective. Is what precedent do we have for this concept in previous build? Are implementers asking for this kind of concept? And you can help us with that as well. Again, this is formal. So, and then those of you who've been around know that what you say in this meeting as we enter into review is not an end-to-end review comment. We have conversations in this meeting. Every comment needs to be documented in an email. And I know that sounds annoying, but it's to ensure that we are collectively, responsibly editing our work. Hi, Lucy.
Hi, Sarah.
Hi, buddy.
I think it was last meeting or maybe the one before, you said that you came upon the utility agency for Los Angeles
Yeah.
and you learned so much from it.
Yeah.
I'm wondering whether you're actually in contact with any people there or whether anyone on this call could be in contact with any utility regulatory agency just to see whether our understanding
Hmm.
of really what they do and how it affects people comes across to them. I'm just wondering if that would be a kind of review that would be helpful.
Lucy, that's very thoughtful, and we actually are kind of doing that, right? So we, when it came to the terms that we're building under the LIHEAP LIWAP, we reached out to ACF and have a pending meeting with that team to make sure our definitions align with their purposes. We haven't yet reached out to a specific municipality, but I know I just saw Diana's here. Diana Hernandez is like, if you the papers that we have on the confluence that represent her, not her area of expertise, are pretty amazing. And detailed specifications of how these are operationalized on municipal levels. We certainly can reach out to different municipalities, but right now we're referencing the work that Diana did to that same mission heavily. Because of specifically there's a paper on the confluence that is a summary assessment of all energy insecurity programs known to humankind operationalized in the US. And that has really helped us make sure that we're getting it right. We certainly can reach out to different entities though as well. But right now we are reaching out to ACF and we're referencing Dr. Hernandez's paper.
I didn't think you
I
had
just
enough
want
to do, so I thought I would suggest that. Thanks.
And Diana,
I just wanted to, yeah, Lucy, thanks so much for the suggestion. It happens to be that the timing is good because I will actually be meeting with our local utility next week on Tuesday. Is there a specific set of questions or something that you think we need to verify with like utility providers that might help to ground the work? And if I can just start to see that maybe in my meeting, I just want to hear from you what you think is necessary or would be kind of all of the really amazing work that the Gravity Project folks have been pulling together.
Thank you, Diana. If I were meeting with them, I would alert them, number one, that this is being done, that everything they do has enormous consequences for people and their health status. And this is one thread within the health sector that is starting to look at that in a uniform manner. This will be news to them, I assume. So if you discover even a flicker of interest, given what must be your very busy agenda, maybe you have the link handy or you print something out and leave it with them and say, if you have any comments, I'd be really interested, or call Sarah, I'm too busy, or, however you want to handle that. If you can fit it into your agenda, let them know this is happening, because then when they start circulating in their circles, which most of us on this call never get near, the utility agencies of America will start to realize that the way they behave has enormous implications for population health.
You got a heart sign from Diana. And the truth is, Lucy, if Diana has that conversation with them, because she's offered to, more just like we're seeking ACF a review on their aligned concepts, we have energy company aligned concepts, right? So it's reasonable to ask if they seem fit for purpose, and certainly alerting them is a good idea. Thank you, Lucy. You're always so
Yeah, great. Look
Thanks.
forward to what happens, Diana, if you can tell us on a future agenda. Thanks.
And I
Yeah,
always
happy to report back. I mean, I've been doing this work for so long, and I do think that this is a special opportunity to kind of learn from them. But I was asked to teach, and so I'm going to do what I can do to just inform them about like the importance of these issues and how their practices around disconnections, for instance, and the debt that people carry and things like that, like end up being really consequential for health, especially. So I will definitely drive that point and also alert them to the fact that this process is happening. So thank you so much for the suggestion.
Thank you so much for doing this. Population health is one outcome of everything they do, an outcome they pay absolutely no attention to. So this sounds like the beginning of a lifetime of changing how utilities view their behavior. Thanks so much.
And for those of you who haven't read Dr. Hernandez's paper that she put out on the one that had just come out when we just started in April on health consequences of energy insecurity, it's a powerful paper. If I were a utility company and I read that, I would feel like I had my call to arms. So thank you, Lucy, and thank you, Dr. Hernandez, for being such an expert in this space. We really, really appreciate you. And we'll try to get that. It's on the Confluence and the references section. There's a whole Diana section. But yes, we would love to share that. It's a powerful, powerful paper. And we are very, very grateful Dr. Hernandez is with us.
Thank you, Sarah. I can't stand the Confluence website. That's why I
No,
asked
I know. We're gonna, I hear
Okay.
you. We'll drop it.
Great.
Drop it. All right. So you formally submit anything in the end-to-end review. It's a different process. Again, it has to go through as an email, and then we vet it with SMEs again, because we really try to be careful about how we curate and manage the master list going forward to make sure that it's not too disruptive, given all the work we've done to get here. And then we will find that link and put it in the chat. Okay, next slide. This is speaking of how awkward the Confluence can be, this is this is a guide to the Confluence about how to download the master. If you were in utility insecurity and you were here to download the master tomorrow, 5 p.m. PST, in order to start your end-to-end review, in order to be ready for our next meeting on May 2nd, because again, that's what we want you to do. Look at it. And again, there's some TBD things, because when you create new concepts, you need to create new definitions. So some things don't have definitions yet. But if you scroll down to the bottom of this page, that's the references section. We do try to do that. But this is how you download the master tomorrow at 5 p.m. PST. Next slide. Okay, so this is where we have updates based on implementation feedback, right? Or updates based on our own meta end-to-end review. Like sometimes I just sit, I have to sit back and look at the whole thing all together. Like, what have we done? And so these are things that we want to make sure are brought to the consensus space and then included in our value sets in order to be used by implementers. Next slide. The first one is not a surprise. It's an update to medical legal partnership and legal aid definitions based on ACF, Administration of Children and Families, creating a formal federal definition for MLP based off of their MLP Plus program. And again, we didn't have a formal federal definition, and now we do. And so we revised both our this is not a concept definition. The program itself has changed. The definition is changing, and we wanted to make sure you were all aware. And Samantha Morton talked about that at last meeting. And here she's, so thank you. Sarah Bahal dropped all, well, not all. She dropped the Diana Hernandez section into the link. Thank you, Sarah. And then this first one is the one that I'm mentioning would be the call to arms if I were a utility and security person. I mean, a utility provider. Next slide. The next two slides are new things in the all domain updates. And this is a kind of a busy slide, so I'm going to walk through it. So part of being a listening and learning and iterative community is that implementers give us feedback on necessary enhancements. One of the most common things that we hear from experts in social care and social service navigation is we really have to make sure we build the correct terms for the places people need to go to get services, right? And so if you don't have the place you have to send the person in your terminology, it's hard to, you can't discreetly send the person there. And for people who are not, or naive or not as well informed about navigation, they might send somebody to a place that's not helpful, right? And so we are continually trying to assess our terminology. This is what I mean, like stepping back and thinking really big, right? Have we built the concepts we need to get people to the right place, to get the help they need? And we noticed an absence, critical absence in our housing terms, because although we built the housing program types like Section 8, we don't specifically have Section 8 housing voucher, but we have the suite of rental assistance programs that are offered through HUD in our set. We did not have public housing agencies. And public housing agencies are where you go to get the help in order to sign up for rental assistance and Section 8 housing program or public housing. So we are going to, we're bringing it forward as a term we need to build, because if I can't navigate a person to the correct place to get the services, then that's a problem, right? I'm a clinician. I want to have someone get the help they need. I send it to public housing agency. And this is again where all of public housing and housing rental assistance programs authorized by HUD happen. So that's kind of an easy one, and I have right now a statute definition that's part of federal statute. We'll fix it in time. We're going to tweak it. Another thing to note is the moment we talk about anything coming from federal funds, and we've noticed this through energy and security and water security, is that we have to think about ways that things are operationalized for state agencies and government agencies, but also how they're operationalized in tribal entities, because tribal entities are independent nations that have money from HUD or from Department of Energy or from ACF and operationalize it in their own way under their own authority. So public housing agencies are not the way across the board how a tribal member would access HUD programs that support rental assistance or public housing. They would go through the tribally designated entity, right? So Gravity's really trying to make sure that we don't commit a data injustice and not build the ways that tribal members would access services. So we're proposing two new terms: one, public housing agency, which is the place I go to get the programs we've already built in Gravity that relating to HUD rental assistance and public housing. And then another tribally designated entity, which is the place I would go if I were a tribal member and trying to access tribal housing or tribal rental assistance, still coming from HUD, but in two different places. Does that make sense? That was a lot of words, right? We just literally didn't have public housing agency Whoops. And we didn't have tribally designated entity. Whoops. We're trying to build them.
So Sarah, when you encounter a patient, is it part of routine demographics to discover whether that patient is a member of a tribe?
Absolutely. Yeah.
Okay,
Yeah,
thanks.
absolutely. So the FQHC that I work on it encompasses like tribal entities. Unfortunately, it's not a federally recognized tribe, so it doesn't get these kinds of services, but there are different services that are authorized that they're only eligible for because they're a registered tribal member.
Okay, so anybody working in FQHC and hopefully other people on the call working in other settings also would have routine knowledge of people they encounter directly and whether therefore it's appropriate to refer them to these tribal entities.
And
right?
this is part, yeah, and I think I saw Elena on the call. This is part of why establishing eligibility is an art, right? Because there's many different lenses through which eligibility is established. And sometimes it's established by, I'm a tribal member or I am not. And sometimes it's established by an age criteria or a medical condition or an income condition right? So these general buckets for these very specific federally supported programs are kind of easy. And then further elements of eligibility is just an art, right? And this is why getting the people to those places, the correct places to establish the programs that they're eligible for is also really important. Again, FQHCs are lucky because, my FQHC has community health workers who are trained in navigating because, any entity to the correct services. And we have, most like lots of WIC and homeless management information system and coordinated entry happens in FQHCs. But again, this kind of knowledge is inherent to delivering thoughtful social care.
Yeah, and Sarah, if I can, I always say,
I called you out, Elena. I did.
No, thank you. There's two pillars to eligibility. There's the problem statement, or like the reason someone needs help, right?
Mhm.
And then there's the kind of essentially non-problem statement related facts about a person's life and situation. So it's like, the zip code they live in, their age, do they have children in the home, the household size, like, it's not just demographics. It might also be something like, do you belong to a federally recognized tribal community, right? So like all these things. So there's all the things that are identified as a need that is going to be met by a service. And then there's this whole other pillar that's just information that is true about what it is to access services for this person's specific situation.
And luckily Elena is a pro. All right, are we good with this, right? And I want you to know this kind of thing, auditing our programs to ensure we've built the correct places to send people to get help is part of what we're doing right now at Gravity. Again, thoughtfully, right? Because if I'm building a refer to concept, I refer to public housing agency, right? Because they need to help. They can help the person. Just like and LIHEAP is one of those you can refer to because the LIHEAP office will help as well. Okay. This will be here every time now because they're part of what we're thinking about going forward to May 16th. Next slide. These are concepts that we've talked about in other meetings. We've yet to present, but we can't put them in our consensus value sets until we talk about them here. And that's on me. I suddenly was like, wait a minute, we haven't talked about the new calendar year terms. I am not going to go into depth on them. If you want to know complete nerdiness regarding these HCPC terms, you can listen to the affinity meeting from March. It was a deep dive into the HCPC codes that were released as part of the Medicare 2024 physician fee schedule. There's also a fact sheet that we have on our resources tab for these concepts. You can just download it right from and we'll put it in the chat for those people who are Confluence averse. We got you, Lucy. But the important thing for these is really CMS is responding to a need to recognize the labor of community health workers specifically and supportive people in the ecosystem to address social needs by building ways to reimburse that labor. Period. Gravity's been working on this for a very long time. We're very, very excited these concepts exist. We know it's for Medicare right now, but we're hoping to, carry it forward. So there's the reason why there's a gray line is there's one clinical term, which is like only for the practitioner, and that is a chunk of money for if you're delivering an evidence-based risk assessment, like you have like a person has a medical condition and you want to understand if social determinants of health are influencing management of that. Like I do this almost every day when it comes to diabetes management and heart failure management in medicine. Like, hi, your A1C is out of control. Are there any drivers I'm missing to why? Oh, you can't afford your medication. Oh, you couldn't afford the gas bill, and so you paid the gas bill and you've been eating mac and cheese all month. I hear you, right? This is what we do every day in clinical medicine. So this SDOH risk assessment is leveraging a standardized instrument and approach to assess how social determinants of health are influencing a specific clinical condition. FQHCs are not eligible for this because we already get enhanced reimbursement. It's already included in the model, but that's just a note, right? And then the other two are not clinical based or don't have to be. They can be a clinician, but it's really like a community health worker in your clinic or a community health worker or auxiliary personnel at the food bank or at the housing agency or at the local nonprofit. It does not matter. As long as you're working in collaboration with a clinical partner and feeding it back, because the whole point is collaboration. Like, I need your help, person out there in the social care ecosystem expert. This person has this, please help. And then they have to feed that information back into the clinical system. But it's a significant amount of money that's made to support community health workers. And again, I'm not going to go in community health workers and auxiliary personnel and delivery of social care. The labor of it, of taking care of people. That's all I'm going to say now because I just introduced you to this. Please listen to the recording on the affinity group because again, it was an hour and a half on just these concepts, and then we'll come back around. Is that okay? And the fact sheet's there. There's all kinds of good references, but these are really, really important concepts to have in the ecosystem. And I see a comment regarding an instrument submission request. I believe it's similar to when we got in an email. I have a response to you coming. I'm sorry, it was a very busy day. We have a process by which you analyze your instrument as whether it can be included in value sets. Coming soon, email reply. So these concepts, the reason why only three of the four concepts are here is because the last is strictly mental behavioral health and therefore out of scope for gravity. Again, read the fact sheet if you like, listen to the affinity group. You can also read the final rule if you're completely nerdy. But these likely should be included in our all SDOH value sets as possible interventions. There is no list. And again, I'm going to say the affinity group does a really good job. So insofar as recommended instruments, it represents the AHC, HRSN, social needs screening instrument. It references prepare, and then it points to gravity. So the reg literally says, prepare as an example, AHC, HRSN screening tool is an example, otherwise, whatever gravity does. So we are included in the reg as recommendations for screening instruments. So that's great. So this is partly why, yeah, that's a great thing because it basically aligns with the CMS DSNP regulation, which also included pointed to gravity. Whew, okay. These were a lot of updates. Okay, next slide.
Sarah,
Yeah.
sorry. So I've read the CMS facts sheet
Yeah.
and I want to know more. It says go to gravity. Does it give a link to the Confluence page? And if so, is there a box on the Confluence page that says, if you're interested in what CMS told you to do, click here. Otherwise, people are going to go to that page and shut it down.
We are working with CMS to create one-pagers, so it's not as overwhelming.
Terrific. Thank you.
On the list, Lucy.
Okay.
Next slide. All right, so now we have to get into the actual utility and security terminology. It was a big couple of weeks for gravity. Next slide. We're doing end-to-end review now. Refinements are the theme. Thanks to our SMEs. Diana's here today. Thank you, Diana. And Debbie mentioned she might be here. I think lovely. My friend Stephanie is on spring break with her kids, but we couldn't have done any of this without them. They're brilliant. We love them very, very much. Thank you all for being part of this work. Next slide. Next slide. We're going to scroll through because again, we covered a lot of, we have about an hour left. Okay. Whenever people mention things, and Lucy, you're really good at mentioning things, we want to make sure that we hear you. We heard, Lucy, your recommendation for giving levels of evidence and grading validity on this table or some kind of presentation. We are working on that. It is not ready yet in the cacophony of all the things, but validity grade to come, Lucy Johns. We did not forget you. We know these things. We know the gold standard instruments. We know instruments that have been completely psychometrically tested. We know we can do this. We just are working on it. It might just take a bit. Next slide. One thing, so someone did ask, is there a list of the SDRH risk assessment tools that meet the criteria? We could put in the gravity if we're not busy enough. But for this purpose, we did create a table of all gravity approved instruments and their status of being included in LOINC. We will drop that link into the chat, because if I were wondering whether my instrument aligned, I could look there and it would tell me. And again, what the SDRH risk assessment, it wants you to assess across food, transportation, housing, and utilities, those 4 biggies. You can do more, but they really want to make sure you lean into those 4. I just realized that there was a comment we could support with. Okay, next slide. And then this is what Lucy was talking about, scrolling forward. We did talk about dependency on electronic medical device and adaptive equipment, and how that was a critical additive element. It's not specifically a screen for utility insecurity, for energy insecurity, but it's important. Next slide. And there's Sarah Bahal. So if I were looking for whether my instrument was approved, I could find it in the approved screening instrument table that the amazing terminology team, not me, worked on last year. Thank you. Next slide. This is that form that Lucy was talking about the LA Power form, which is again a partially an eligibility requirement. This is what Elena was talking about. You can see some of these elements would be used to determine eligibility, and then some are the presence of that supportive device or adaptive device. Next slide. Next slide. Okay, updates in red text. And then also we have highlighted differences across concepts in bold to try to make it easier for the reader. Next slide. We have no change to this slide. We did want to know, a long time ago, we updated the utility assistance program definition. Again, these are easy bucket concepts that have not changed since we last saw you. Next slide. Next slide. This has not changed. Here are some changes. And again, you can see things that are being removed here and things that are changing. Again, an end-to-end review is adding things that are missing, changing things that are wrong, and then removing things that seem to be extraneous, right? So in all of our research, we identified that the low-income home energy assistance program fuel cash grants is operationalized through the low-income home energy assistance program heating assistance program. And so it's not different. It is what happens within it if you if you need that kind of service. So it's not a unique thing. And that meant it was difficult for us to find a reference for it, even though we had a definition. And so what we do in these instances is we build the concept that is the unique thing, and then do an includes but not limited to. So if I was trying to figure out what's included in this, I could see this is included in the fuel cash grants concept is included in the low-income home energy assistance program, heating assistance program. So it's just, it is not a unique thing. So it got moved under LIHEAP, but it's called out as an example. There's slight edits because we added programs to things that are programs, just the, a gravity terminology syntax thing. And then we did have conversations regarding a new program and the definition. I'm working on it. There's some Department of Energy resources. And this is the energy literacy program. This is in the aim of reducing, there's all kinds of facets to energy literacy, whether it be really easy home weatherization that you can do, like putting plastic in your windows or sealants around your doors, or improving the energy efficiency of your home. There's like a core Department of Energy curriculum. And then Dr. Hernandez was speaking to it as being sometimes a part of a operationalized LIHEAP program. So we are suggesting this is a concept because it's operationalized in the energy and security space, and I'm working on the definition from the DOE because they have a ton of material. And again, whenever we're able to point to a federal reference, we do. Whew, okay, next slide. We are changing, this is a definition change, weatherization assistance program. Again, we're figuring out how to differentiate weatherization assistance program through LIHEAP and the other ways weatherization assistance is operationalized has been a work in progress. We thought about whether we should build specific weatherization assistance programs for every single entity that operationalizes them, meaning states, tribes, and territories. We didn't feel like we had met that criteria, so we're working on a single weatherization assistance program concept that represents all of those for now, that could be the parent for future children, but right now is serving as the way the Department of Energy sends funds to sends funds to entities to operationalize weather assistance in local instances. And then there will also be, of course, the LIHEAP specific weatherization assistance program. Whew. I'm doing a lot of talking today. Next slide. Again, if anyone has concerns with any of these things, raise your hand, talk about it, but also send in that email because this is what we're doing. We're just auditing, clipping. These are clarity changes, really, because when we looked at our state energy rate affordability program, we just didn't think it was clear enough. If I didn't know what that was, would I know what it is, right? And so we're suggesting a change to state energy assistance program for rate affordability, state energy assistance program for arrears forgiveness, energy company assistance program for rate affordability, for energy company assistance program for rate affordability, et cetera, et cetera. So we're trying to keep this assistance program concept constant. You can see we have parents and children here. So the general parent program is the state energy assistance program or the energy company assistance program. And then there are all of these different subtypes, but the general big bucket program is the state energy assistance program and energy company assistance program. Okay. This is just literally nerdy tweaking semantics, just trying to make things tidy. And if you have any concerns, let us know. We'll review the master tomorrow. Or you can let us know now. Next slide. Again, we didn't want to neglect to include any entity that might, that is non-state. So if we basically, whenever we have a state blank, we are ensuring that we have the tribal correlate. This is our ensuring, best practices and processes. So we're getting the definition here, but there are actually really interesting tribal energy assistance programs. Diana led us in a really fascinating conversation about this on Friday. Lots of really interesting uses of solar programs in tribal entities. And so this definition is coming. Again, Sarah's reminding you that if you have specific comments, please send them to gravityproject@hl7.org so we can log them formally. No other changes here. Oh, except for we have 2 other changes. My apologies. 2 things that we analyzed and removed. So when we looked at energy cost crisis assistance program, I, for the life of me, couldn't remember how it got there. I'm going to be perfectly honest. I was like, how did this get here? Because it's contained in other program names. And so we thought if we couldn't defend how it got there, it probably didn't need to be there. And the last one is precedent, charitable energy assistance program. In no other domain have we specified the type of service you're getting at a charitable organization. We have charitable organization as a referral for food, for housing, for energy, for transportation, right? And not in any other domain do we subspecialize. It was charitable food assistance program, charitable housing assistance program. The reason being is that it's one-off, impermanent, not sustainable help, right? You get a little thing and then you're out, right? And so we didn't feel, and we can represent the concepts of what you're getting with terminology that we're building for other purposes in this domain. So we are recommending that we don't build a charitable energy assistance program, because again, there's no precedent for that. And if you want to distinctly represent the help someone got, like crisis assistance, right, or utility deposit assistance, we will have those concepts you can represent elsewhere. Because usually the help you get in charitable organizations is that type of thing, like paying off your past debt, or giving you assistance for an activation fee, or giving you assistance for the deposit. Not ongoing assistance with the cost of utilities over time. Next slide. Trying to get to everything. All right. And then we are just, kind of tweaking terms here. So these are concepts to represent when you are patients enrolled in a program that, or can be referred to a program that prevents utility shutoff. We know by federal regulation, again, we deep dove into federal reg, that there's age criteria out there, there's there's medical certification that you can go through, whether it be that you have, again, sometimes this is because you have an energy dependent medical device, sometimes because of the status of having, being on SSI, or being in the, federally determined disabled. So we have those two concepts. We just changed the wording a little bit, but nothing else changed. Next slide. We are realizing that when it comes to specific children of utility shutoff protection, and this is again this is a missing end-to-end review, that we should have concepts that specifically represent how water, we were about enrolling people or referring them to water shutoff protection and energy shutoff protection specifically, and not just utility shutoff protection. You all can say this is not necessary. The utility shutoff protection terms work, but given that you send people and enroll people in very different programs with very different often different eligibility criteria, we thought that these might be necessary. Again, you can help us if you feel like these aren't necessary, we can not build them, but this is just from a completeness perspective. Next slide. You can see just little tweaks. We did create a definition for water services assistance program to mirror our utility and energy assistance programs. We just changed some of the wording because it's operationalized differently, right? So municipalities manage a lot of the water services assistance programs. So we changed that from the energy company. And we have water service companies, charitable organizations. Again, this is the fluffy term to mirror the energy assistance program, utility assistance program concepts. So we have these two, and this will represent the Los Angeles example, where you can get enrolled in a program for reducing the cost or managing the cost of your water bill. Next slide. Okay, and then all of those concepts, once they're finalized, will get dropped into the intervention framework. And so we'll be wrapped around the evaluation of eligibility for, or provision of, or referral to education about X program. Next slide. Now we're going to diagnosis. There's some big updates here. Work in progress. Again, the terminology team is pretty busy on this count as well. Just working on making sure the meanings are correct. Next slide. And again, we're reminding you of this because this is where the edits to some of the definitions come into play and where it starts to matter. Next slide. We are working on definitions that are robust enough to represent all the facets we know to exist under the insecurities we are discussing. The previous slide talked about those dimensions of financially driven insecurities, right? Worry, stability, quality, safety, quantity, do I have it or have not? And then sometimes, dependent on the insecurity, cultural acceptability. So we've talked a lot about water insecurity and how within our work right here, we're really staying within the lane of what is driven by utilities and cost. But how we know from Jackson and from Flint and from, too many sad places, it doesn't cover the breadth of household water insecurity and how it's experienced, right? Because we're not addressing the quality components and the safety components within our water insecurity concepts right now, and we will in future work. And this had us step back and again, try to make sure that we represented safety well and within our work. And again, I'm just going to tell you, it's really hard. Creating definitions is really hard because you have to think about what concept the safety is describing. So we are exploring, applying, massaging, refining, nuancing, hours and hours, hours and hours, these new definitions to see if they meet our purposes better. Again, the intention is to ensure that we represent the breadth of what these insecurities can manifest at the household level. There we go. Thank you so much, right? Janice is giving an example, right, about just what's happening today in Albuquerque. Lucy?
I'll put this in the chat too. I'm wondering about why the word household is in all of these definitions. Does that add value to the definition? Does it exclude anything we should be thinking about?
You're really good about talking about that. And we can revisit. So pretty much most measurements of these insecurities are at the household level. That doesn't mean that the unhoused do not have these insecurities. I don't know if we were talking about homelessness, but you did bring that up before. So classically, homelessness is so high risk that all of these insecurities are included in it, right? So if you're homeless, you almost by nature are also utility, energy, water insecure. But most measurement, actually, I would say most, all, I'm not gonna say all, are about the household experience. Diana, you are with us. Do you want to clarify that at all? Maybe she's, I know I'm
Yeah,
calling.
no. I agree. Yeah, no, thanks. You know, I'm always kind of multitasking, but I'm fully on. I would say that I think you're right, Sarah, and kind of calling out that homelessness is kind of such an experience that if you're without an address and a place to live, then you won't necessarily be able to plug in or you know, to use water for hygienic purposes and or for drinking or other things that are kind of consistent with our definition. So that, I mean, I think an important inclusion that it include food, or rather that it reference specifically people that are housed and then have these issues. I think that that's one way to, you know, kind of think about it and create a little bit of a guidepost for thinking about who's impacted by this issue. It's really people that are indeed housed.
And if it's okay, I'll just add, Lucy, there's household gets defined often programmatically and situationally. I saw that Janice put in the text that, household of one happens, but like, for instance, for SNAP, who do you eat with is the household that's being considered. When you're getting like state utility assistance, household income is everyone in the household who earns money over the age of 18. Mm-hmm. Under the age of 18, household income is not counted, right? So there's a whole bunch of different like situational definitions of household. And so that's often typically why household is interwoven into the language, because it's typically both of what is considered, but also who is the target of intervention and who's being served by the program is often making the definition of what does it mean to be a household.
Also, I think it is bound in part by the domains of reference. Energy is experienced differently than a utility for an individual who's not living in like utilities are by definition the delivery of one of these services to a place. But you asked, I mean, you always ask this really good question. And so I don't know if any of those answers were good and were robust enough or really hit the nail on the head enough. How do you recommend we address the gap that you're naming? Like, is there a way that you feel like, because we know it's usually defined as household. Elena described all the ways household is operationalized. We see Janice's comment there too, but I hear you calling to light something that might be a gap, and I just want to make sure that we're articulating a path forward.
I guess I'm wondering if you deleted the word household in all of these in progress definition cells, would anything be lost? And would people using this therefore think beyond the classic household where a utility bill goes, for example? Would there be any benefit for simply deleting the word household?
I
I'm
think
gonna
there
state-
is,
Oh, I'm going to just state quickly, I think that you lose the capacity to measure it in a standardized fashion unless it's at the household level. Every single one of our instruments is a household level instrument. It is the measurement. Right,
Great.
these concepts exist outside of the household. There's community level concepts. There's other ways of conceptualizing them, but our measurement that we have in the ecosystem to help guide that this is a this and not a that, they're all household measures. It's the household energy insecurity scale. It's the household water insecurity scale. It's the household, so that's the reason why it's in the definitions is it's in the instruments, it's in the standardized processes by which we measure and define the thing for the yeah.
Okay, thank you for this tangent. Okay.
No, it's not a tangent. It's a lovely conversation.
I think every government entity uses household, so
Mhm.
it just trickled down into everywhere, measurement, everything. Yeah.
The household water, the HWISE instrument, which it's not appropriate because it doesn't talk about utilities. It had a really nice diagram of like individual level, person level, household level, community level, state level measurements for water insecurity. But certainly all of our measures are household level measures.
Something else to think about here, and us that have worked with individuals who are vulnerable or, under-resourced, when people get really overburdened, they can, in their water might get cut off or whatever, they might put it in their children's name. I mean, this happens a lot more than any of us like to hear about, but
Thank you, Molly.
it's a household. So when that individual, whoever whosever name is used, there's somewhere they're listed as a household, and that can, anyway, can show up later on their credit report and everything. But I know it's just something to know that it could be anybody in the household. There could be 5 people living together, and only one person's name will be on whatever, right?
Yeah.
You don't put everybody's name on most of these.
And then Molly's just showing that diagram that I mentioned. Thank you so much, Molly. Okay, so I think any other questions on the household concept? We can go, but mostly I want us to see that this is what we're doing to try to build safety in, again, because we do not want to build a concept for water insecurity or energy insecurity that doesn't include all of the dimensions that we know matter. Right, so we started from the beginning. We know that there are the dimensions of economic driven insecurities that matter. And all of this was to try to figure out how to put safe in there, right? And so the way we are exploring is as and this again, we looked at precedent, we looked at transportation insecurity and food insecurity, housing insecurity, homelessness. We looked at all of our past definitions. And we realized that perhaps the best thing to do is describe what we meant when we said adequate. Like, what does adequate mean, right? Because otherwise it's just a term that doesn't have like what does adequate utility services mean in the old definition? And so we leaned into that, and we pulled out again these concepts that are measurable. They're through the household energy insecurity scale. They're through Diana's instrument, right, about safety and stability and affordability and sustainability, right? So that's what we mean when we say adequate. And then we even leaned into describing what basic household energy needs means, right? Because again, this all started when we try to figure out where the safe goes. Where does the safe go? And then, and so you can see us in the first one, we're describing or giving examples of what basic household energy needs means. And again, these are all part of Diana's literature or the greater literature about what we are watching to see if it's affected. So heating, cooling, lighting, cooking, refrigeration. And then there's medical electronic devices, right? They matter. And then these concepts of what are the household needs of reference for water are contained in other scales, like the HY scale that was just dropped in the chat, right? So drinking, cooking, preparing food, bathing, laundry, etc. Like what household needs are we watching to make sure that they're not affected, or are we concerned about when they are, right? So in our attempt to represent safety, here's where we got. This it still has to be refined with our lovely subject matter experts. You're not going to see these carried across all the definitions yet, but again, this was driven by all of your comments. Thank you so much. And driven by going deep into the literature and making sure that we applied all of those dimensions that matter and all of the experiences that matter into our definitions, so we didn't block anything out. And then other than that, we just see that we made the capital I small i's. Next slide. Okay, so this is where you can see that we're trying to bold concepts that are different. So Lucy, I think that's digital access, I think, right? I think that would be contained in that, but that's a good point. She's asking about communication access, right? That's a good point. That's not, I don't know if that's part of the basic one, and when we did cover that in digital access, I'm just kind of mulling over in my head. So you can see that we're trying for the reader to have not be a sea of words and trying to highlight bolded elements as what's unique. No changes to the slide though. Next slide. Again, no changes, but we're trying to bold elements that are unique. Next slide. Again, no changes. Again, the only thing that hasn't happened is that theme of those definitions that we mentioned on that first slide haven't been carried forward yet. You can see how that would be a lot of work. What we do is test it against every concept. That's the phase we're in now, is testing that pattern towards every single concept in the list and seeing whether it works. It's like, you know, it's science. Semantics is science. You know, my aunts, both linguists, would be proud. One's a syntax and one's a semanticist. So next slide. So Janice is raising, so again, we carved out digital access and are trying to figure out phone access as not as utilities for the purposes of this work. We're really just focusing on utilities as defined by the boundaries of CMS is things that are used for like water and
Energy.
yeah,
Energy.
yeah. And so we're staying in that lane. Again, we did address digital access, but we want to remind everybody that when we did digital access, it was digital access, and then we're doing utilities and it's this, and then we noted, and you guys remember from our work last year, that like, where is phone? So it's that little, like, where does the phone go? Because I will test, I think you've heard me say this before, way more worrisome to me than whether or not somebody has internet is whether I cannot even reach them because they do not have a working phone, because they can't afford it. And I have a lot of patients in my panel that I literally, like, they do not have a working phone. And that is incredibly distressful because they do not get reminders for appointments and they have no way to access them. And it's very, very frightening for them and me. So we'll figure out phone in time. But again, we have part of what we do with Gravity is like organize things and then see gaps. Again, we're working on with water. Water was what drove that safety revision. New definitions with the safety component will come in time. Next slide. And then these are those goal statements again. So we just talked about we call them diagnoses, but they're really like, that's what they are. I know it sounds medicalized, but I've done a lot of research into diagnoses to understand assessment, and education uses diagnosis as well, and all kinds of other friends. So I'm trying to be content with the diagnosis being the outcome of an assessment with some backing that's not just clinical. But these are our goal statements, right? And some of these are already existing in ecosystem, and then some are new. And Janice, yes, so the ovens as heating sources is part of the foundational work of our friends at Children's Health Watch, because it was an emergency room based research, and they were trying to understand how the injuries they saw were being operationalized. And it was driven by energy insecurity because people were using ovens as a source of heat, or unsafe elements as a source of heat. So that safety component is embedded in energy insecurity as well. Absolutely, 100%. A passion of Debbie, one of our SMEs. And okay, I think we're good here. Next slide. Okay. Whew. That was a lot of words that I imagine some of you might need to review when you look at the recording. Remember, all of it's contained on the master list. So the things that you see will transfer to the master list tomorrow at 5 p.m. PST. And then it's our collective job to refine, look, revise, consider that master list. If you see an error in capitalization, let us know. If you have concerns about removing something that we removed, let us know. Formal emails, remember, gravityproject@hl7.org, because now we're in this formal process where basically we've worked so hard to get here. We need a pretty good reason to take it out. Any questions before we head into that, before we close today? I'm glad I have tea with honey. That was a lot of talking. Anything else? I hope you feel like we're faithfully representing your work. The next work, homework, next steps, next slide. All right, so as conversation as the confluences, it's where you go. And so please look at the master. We really want to make sure that you have the master to review. It's helpful to us. Ask these questions of yourself. Are we missing something? And you can see we already feel like we're missing something. So we're exploring filling in gaps. Is something incorrect that needs to be changed? Is something unnecessary and we feel like it can be removed? Again, you already saw us doing that with one concept. I couldn't even remember where it came from. And then that charitable organization concept, because we've never sub-specified it before. So why do that now? It was like a precedent question. Send in any of those with a rationale and hopefully evidence. And we do hope you can suggest alternate approaches. Again, we try to make this formal, like not this because of this, why not this? And send it to gravityproject@hl7.org. Next slide. And I think we're out. Join us in 2 weeks. And we look forward to seeing you. And welcome. And then if that comment, again, the instrument question, we have an email coming to you shortly. We have a process for you to evaluate whether your instrument applies. And we'll see you in 2 weeks. And thanks for all you do. Bye, friends.
Bye.